Great. Thank you, Renee. Thank you everyone for joining us. It is right at 11, but we'll go ahead and get started here. I think you all know Tariq Smith by now. He's our evaluator, and just a wealth of knowledge on all things grants. So I'm going to go ahead and turn it over to Tariq. He'll be doing the first portion of the presentation today on creating a data collection program and plan. And then I will follow up with some tips on budgeting for grants. So over to you, Tariq.
Thank you, Mary. Good morning, and to most, I guess to some, afternoon to others. Hope everybody's doing great. Glad to be with you again. You all know my style. Please jump in whenever to ask questions directly. We'll try to address them as we go. Drop them into the chat. We will absolutely address them on the back end if we don't get time to today. So, Brandy, my lovely assistant, can you please bring up our first, I guess, the beginning PowerPoint? I'll start the day off here talking a little bit about data collection and data management plans and just kind of some general things for us to think about as subawardees. And I'll also, as always, give you some big picture stuff so you can kind of take it and shape it to apply this. Even as subawardees, all of your processes count. Everything that you're doing, all the great work that you're doing is counting. So the idea here is to make sure we're capturing it in all of its different forms so that it gets reported in the necessary places. And also to let you know that it's not double dipping, right? I know a lot of you all have complementary funding that for you're leveraging your, we use our fancy language, right? You're leveraging your grant portfolio to expand, to support programs. So the idea here is that just to make sure, ring this bell one more time, get everybody on the train together so that we're collecting our sign-in sheets, we're counting heads wherever we can, and then we're also counting everything that we can too, because so much of what you do also goes uncounted. So we want to also rectify some of that and make sure that we are getting good data in. You know how it is with this stuff, everybody. Garbage in, garbage out. So as they are trying to make all of these systems end up talking to one another, it behooves all of us to kind of make sure all of our data collection is all on the same, we're all on the same gang. So there's a lot of different language, a lot of different terminology associated with it, and it gets a little bit wonky. So I'm going to try to cover a bit of that, and then we'll dance. So let's turn on the music and go. Brandy, get us started.
Absolutely. TTA Module 3, Data Collection, Program Evaluation, and Quality Assurance, Facilitator Tariq Smith, Program Evaluator, TCCN.
Thank you, ma'am. Jump straight into that template. I think the first thing we're going to do is actually look at our TCCN template, and then I'll get into some kind of background information behind it. But this should be familiar to I guess most, or not, if not all of us. Mary or Renee will tell us exactly where to find this on our website. It's right here for you now, but it's all of these things are available to you. And as usual, we will post all of the PowerPoints and references and such soon after. So
I'll drop the link in the chat, Tariq, so
thank you.
Everybody can follow along.
Perfect. Thank you. So, all right, Brandy, kick us off. Read a couple of these domains for me here, just so I can kind of highlight a couple of them.
Absolutely. Our columns at the top, from left to right: metric, event 1, event 2, event 3, and event 4. And our rows from top to bottom: event details, name of event, date, time, location, number of participants, number of individuals vaccinated, number of rides provided, and number of appointments coordinated.
Okay, pause right there. So you see, we're very simple here. We want real cookie cutter numbers here, the numbers of the events, the names of the events. A lot of your events will be similar. Like if you're having small group meetings that are reoccurring, these events will be similar. They may have different kind of topics. You may massage what the different subject matter is that's covered, but the big idea here is to document the individual each event as it stands, along with the a couple of different parameters. We'll get into demographics a bit. I'm not going to get too deep into it with this PowerPoint, but I do want to say that, you know, everybody, a lot of folks have different um, requirements for demographics. You know, the census has ethnicity slated as Hispanic, non-Hispanic, and then has a column or so of given races here and there. It's a good guide to guide off of the U.S. Census, and then also add in the nuances that are particular to your specific domain or region. So that's something to just kind of keep in mind. Keep reading really quickly, Brandy.
Absolutely. Our second table on the top, we have our two columns, people reached by events in total, and our rows from top to bottom, number of community events, number of social media likes, number of TV impressions, number of radio impressions, number of print impressions, number of website unique views, number of outdoor impressions, and number of newsletter clicks.
These are all aggregate numbers for you all too. So your sign-in sheets will kind of also reinforce what your number of attendees for different events are, and we want to count those individually and collectively. I think that's a kind of a good way to say it. So it helps all of us to, and the impressions. If you have billboards placed, if you have signage placed up, the viewership, you know, the traffic, passing bill, but all of these are fair game. You just need some sort of valid assessment. If there are, a lot of times there are, you know, kind of city ordinances that dictate, or that actually make, that give projections of how much traffic passes a certain, and when you put up billboards, they're basically priced based on what is projected viewership. So these big numbers are big aggregate numbers. They bode well with what we're doing. So we want to also encourage you to look at all of these different kind of things that you're doing, whether they're placed inside or they're placed outside. They all fall into these different categories, and the categorical placement of everything, I think, is the most important point. So if you have questions about what goes where, should this go here, should this go here, it's helpful to kind of look back at a template or a rubric that could help you push things into these big categories. And that also will help with budgeting, which will come in the end with Mary. Keep zooming, Brandy.
Data Management Plan Overview. Public health data collected or generated with federal funds must be made readily available for the public to access, in parentheses, example given, in a non proprietary format and with a data dictionary, and archived for a pre specified amount of time unless there are strong reasons not to do so. These tasks are the responsibility of the awardees, not the CDC. The
Okay.
plan for these tasks.
Unless there are good reasons not to do so. And this is there are often, we're not getting into this. None of our sub awardees, and everyone will correct me if I'm wrong, but we're not really into the we're not talking about distribution of medical records or personally identifiable information and such. These are all good things. Uh, Again, we're getting deep here now. We're going to step on into what the CDC wants from its direct grantees as well. But it helps you all to know what the overall reporting burden is. But for most of what we're doing here, and also for your quality assurance stuff, a lot. I'm sorry. Oh, I'm sorry. So most of what we're doing here, were you saying something, Mary?
No, I think it was one of our participants coming in.
I'm
Sorry.
sorry. Oh, I'm sorry. No, I'm
It's
sorry.
okay.
So most of what we're doing, right, does not, or most of what you all do as sub awardees, uh, doesn't really fall into the category that requires a CDC approved data management plan, but it helps all of you all to develop your internalized data management plans. And all the data management plan is kind of the chain of command, right? The hand from the root to the fruit. As data is collected, who touches it, who holds it, where is it, why was it collected, how was it protected? That's kind of what the grantors want to know that is happening on a service level. So as a subawardee, we also have to encourage you all and to develop these individual data management plans on your own. So I'm sure that you have them in a lot of other areas. This is going to be a general overview to kind of how to get in line with what the CDC, which is the big dog at the table, typically wants. Thank you, Brandy. Keep moving.
The plan for these tasks must be prepared before the data are gathered, and it's called a data management plan. CDC will evaluate DMPs for adequacy. This training provides instructions for writing a DMP that meets CDC requirements.
There we go. All right. Now we're all in together. Let's keep rooming. Ching, ching. All right. Keep moving.
Data management plan. A data management plan is a written description of the plan for the collection, protection, sharing, and long term preservation of public health data. It is a blueprint that will assist in planning for data management and sharing in advance of the actual data generation and collection. The DMP is a living document, meaning it must be updated and revised as the project evolves and throughout the life cycle of the data collected.
And this is just kind of important stuff to think about and think through. Also to talk about public health data. Most of what we're doing, a lot of our subawardees also have direct relationships with TDH. uh, TDH does surveillance. I'll get into this a little bit later, but there's a big difference between surveillance data and research data. So the data that's collected for Tennessee Department of Health and for the CDC and SAMHSA and most of the service administrations, they typically are interested in surveillance data. Surveillance data differs a bit from research data in that it tends to be broader picture, and it also tends to be collected more regularly, not just in the context of a small window for maybe a research period or something like that. We'll get into that a little deeper, but keep in mind in your own notes, make a note here that most of what you're doing is surveillance, and the bar is much higher for research than it is for surveillance in terms of data sharing agreements and such. We are hoping to get into those amongst each other a little down the road a bit, but as we get into data sharing agreements, you all will see the value of all of this. Thank you. Keep going, Brandy.
Conducting evaluations and assessments for DMPs. When determining whether a non research project involves the collection or generation of public health data, the purpose of the data collection activity and the intended use of the data collected must also be considered. This is especially important when determining whether the policy applies to assessments and evaluations. Six, in nearly all circumstances, data collection activities included in quality improvement projects, organizational performance measurement, and management projects, formative or process evaluations, customer satisfaction surveys, and needs assessments will not require a DMP.
That's what I said earlier. So, and that's main a lot of what we do here. So these do not will not require formal DMPs, but for our purposes and also for your purposes moving forward, it's always helpful to develop these on a project or project specific DMPs. Let's keep it moving.
Drafting a DMP. DMP should include all of the following information. 1. Description of the data to be collected or generated in the proposed project. 2. Standards to be used for collected or generated data.
Pause
3.
on description of data for me really quickly, Brandy. Thank you. Okay, so
Mhm.
this is important too. A lot of times we don't want to, it's easy to say we're going to collect data, but you need to give a description of the data that you're collecting and also kind of describe the purpose of why you're collecting that data. This should take you back to a couple of weeks ago when we did our logic models. So our outcomes and these all of these in your data management plan, they should match your outcomes and outputs in your logic model. So the reasons or the purpose for collecting these data should reflect the outputs or the number of individuals served or the increasing number of folks with knowledge and information or such. So the idea is that if you recall from our last session, the linear lines on your logic model are supposed to line up in terms of activities and outcomes. Here is where we are supporting the data that is actually collected and reinforcing the purpose for collecting that data. It's also important to do that just kind of incrementally, as you even on your kind of small reports talk about which data you are collecting, and demographically. I don't want to beat this ride this horse too hard. So let me pause right there. Keep going, Brandy. Let me be careful of time here.
2. Standards to be used for collected or generated data. 3. Mechanisms for or limitations to providing access to the data, including a description of provisions for the protection of privacy, confidentiality, security, intellectual property, and other rights.
That's
4.
really important to highlight that you have. You can always just, kind of refer to your plan for confidentiality. We will touch on that, I think, in another session down the road to talk a little bit more about all of that. But all of these have to be highlighted and defined in your plan as well. Everything goes in different places. Remember, ultimately in your proposal, you want 3, 4 different representations of the same idea. So your data management plan reflects your logic model, which reflects your work plan, which reflects your project timeline. Ultimately, your abstract is a summary of all of these things. So this is one more piece that demonstrates how together you have it, and how relevant the process of data collection is related to the outcomes and outputs on your logic models. Keep it moving, Brandy.
4. Statement of the use of data standards that ensure all related data have appropriate documentation that describes the method of collection, what the data represent, and potential limitations for use. And 5. Plans for archiving and long term preservation of the data, or an explanation on why long term preservation and access are not justified.
And remember, again, these are the kind of demands of the original awardee. So ours not set this high for sub awardees. However, when you see where we have to get to, it's helpful to uh, to help along the way in terms of sub awardees, because the more information that we get in terms of you all and in terms of what you are collecting incrementally, the better we can kind of answer these questions long term. Ultimately, this data has to be all data collected must be protected, and the CDC keeps reminding everyone of that. So keep it moving. And hopefully, if anything's showing up in the chat there, Mary, let us throw or remind or say something. Thank you. Hey, Rhonda, see you just showed up. Welcome. All right, let's go.
Description of the data and standards for collecting data. The DMP should describe the topic, type of study, data elements, and anticipated time frame and frequency of collection. The DMP should also describe where data will be maintained and who will be responsible for the data during the project period. The
Okay.
DMP.
Command. I'm
Mhm.
sorry. Thank you. This is chain of command stuff. This is down to what file cabinet it'll be in, if it's on a thumb drive, if it's secured wherever, and if you, and also reporting increments. So you got to be pretty specific here about how you or who's handling what and how it is. I guess that's it. Who's handling what, and the handoffs, the chain of command, this and the secure system associated with the chain of command, which is, I guess, the uh, biggest points they're bringing here. Keep moving, please.
The DMP should describe the use of widely accepted methods and procedures for ensuring the quality of data products. The DMP should provide a plan to ensure data quality.
Yes, and that is a whole nother subsection, right? So your insurance of data quality is a little deeper. We don't need to get into that during this training here, but as you get deeper into your individual services, and as you get those of you all who are interested in entering into kind of more heavy duty data sharing agreements, we can talk much more about that. Okay, keep moving, Brandon.
What is personally identifiable information? PII. PII is information which can be used to identify an individual person, such as name, home address, social security number, medical record number, telephone number, and email address. PII also means multiple data elements which could be used in conjunction to identify an individual, such as a combination of medical diagnoses, occupation, sex, race, birth year, and zip code.
This is important to talk about. You all do collect some personally identifiable information because you get you collect sign-in sheets at different events and stuff. That must be separate from whatever data you are actually collecting as well. So if you're doing some sort of surveys, or if you are, it's actually even better to have your demographics. I believe the CHWs. If Annabelle is on the line, she can chime in and help me out here. But I believe our CHWs will be collecting a lot of the demographic information from the different community events. Some of it is self-report, but others of it will kind of be other parts of it will be observational. So a good way to do that is to have your sign-in sheet signed just by individuals and have that secured in a cabinet or some other secure place, and then the demographic information uh, uh, being collected by the CHW would be in no way associated with the actual name itself. So the more degrees of separation, the better. Sign-in sheets are good. You can let people sign whatever nickname they'd like as well. You're not checking, IDs on this type of stuff here. So, and the idea here is to document the fact that they are there, but it's also to protect their personal information and also to separate it from whatever other data or information is being collected. So let's be careful about that. In particular, I believe that's some of the only personally identifiable information you'll be getting. Zip code and stuff can be reported in aggregate, and they will when you move into data sharing agreements. They actually get a little concerned about this because those combinations of things toward the bottom of that list there. So a combination of diagnosis plus age plus gender plus zip code may make someone who was previously anonymous now sort of identifiable. That is the concern that we are trying to address in protecting confidentiality. So as you make note here of your what is personally identifiable information, kind of highlight that, flag it, keep it at the top of your list, and make sure that you are always make sure you don't collect it if avoidable, don't collect it. And if you need to collect it, make sure it is protected in accordance with the CDC's recommendations. Keep us moving, please.
Sharing public health data. Public health and scientific advancement are best served when public health data are released to or shared with other public health agencies, researchers, and other partners in an open, timely, and appropriate way. CDC's policy on public health research and non research data management and access states that the results and accomplishments from federally funded contracts, grants, and cooperative agreements should be made available to the public and the scientific community. Data management and accessibility of public health data involves ensuring 1. Data quality according to established standards, 2. Consideration of privacy and confidentiality, 3. Appropriate security and ethical concerns are met, 4. Protection of intellectual property, and 5. Impartiality in the sharing of data.
Thank you. Now, we all benefit from this because this is where we draw most of our sources from, right? Most of the stuff that we're pulling is public domain stuff, and it's because anything that was paid for by federal funds basically belongs to the people, was paid for by the people, belongs to the people. So all of this data is in public domain. It's available for us to use, and the expectation is that the products of the use. That's kind of convoluted how I'm putting it here, but our products or the products of the use of those products will then contribute to the uh, body of knowledge that is available to everyone as well. So everything that we're doing will end up as public domain data. So it's our job to kind of police it on the way in, because we expect those sources to be sure and sound when we find them. So in contributing to that process, they put some hoops to jump through to make sure that they're, no garbage in, no garbage out. All right, keep us moving, Brandy.
Public health data. What is public health data? Digitally recorded factual material commonly accepted in the scientific community as a basis for public health findings, conclusions, and implementation. What is not public health data? Grantee progress reports, process monitoring data, administrative data, preliminary analyses, drafts of scientific papers, plans for future research, reports, communication with colleagues, or physical objects such as laboratory notebooks or laboratory specimens.
I had to put that in there because it's important to know the difference between the two. After these things kind of get aggregated, cleaned up, analyzed, and kind of co-signed for or validated, then they rise to the level of public health data. But until such time, they are not. Keep us moving, Brandy. We're killing it over here, making good time. Let's go.
DMP list of abbreviations.
Oh, this is
AR,
important. Oh, I'm
mhm.
sorry. Go. No, you go. Yeah, you go.
AR 25 is additional requirement 25. CDC, Centers for Disease Control and Prevention. DMP, Data Management Plan. FAQ, Frequently Asked Question. FY, Fiscal Year. NCC, DPHP, National Center for Chronic Disease Prevention and Health Promotion. NOFO, Notice of Funding Opportunity, and PII, Personally Identifiable Information.
Uh, I think that in another training down the road, we talk a bit about the difference between NOFOs like RFPs and RFAs and NOFOs. So yeah, let me leave that. Let me leave that alone for now. All right, let's keep going. This is tempting, but let's go.
Timelines for data sharing. CDC policy includes timelines for sharing data as follows: one time collections or generated data sets, share within 30 months after the end of data collection or generation. Ongoing collections, such as surveillance data sets, share within 12 months of the end of collection cycle.
Yeah, I should have dropped. I didn't need to leave that in. Sorry, I could have dropped that. Keep going.
DMP template. So across
Yeah,
the top in terms of our columns,
yeah. Just read the
I'm
columns
sorry,
across the top for me, and then I'll say something about it.
absolutely. Data set title, study type slash design, frequency of data collection, data collection time frame, where data will be maintained during study period, and responsible person slash contact information.
Okay, pause right there. So I wanted to show the CDC's template as well, kind of on the backside. We started with ours. We're kind of ending with theirs in terms of how the differences are laid out. But you see the domains or the demands are. I guess the bar is just a little bit higher here, but you see where they are, where the CDC wants to go ultimately with all of these things. So ultimately, all of these questions need to be addressed about kind of what has happened or what has the process that of your from the beginning to the end of the identification of the use of the collection of the management of the storage of the reporting of all of your data. And the idea that data management kind of it requires its own plan, and Mary will get into this too next with budget and budget justification. So there's a whole nother kind of everything needs its own narrative, if you will. So for every section of these proposals, the big deal here is to make sure that there is a consistent plan for continuity, and also showing that you are doing your due diligence in being concerned about these things and demonstrating that you have um, measures in place to mitigate any issues, and also that you are looking out for potential issues that don't necessarily exist. So these types of things help you so much when it comes to audits and such, especially from TDH, even when they're kind of subaward audits and things. Just having these things in line as you build them up, as you build up your proposals, are very helpful. I like to do these kinds of things first, along with my logic models. In my world, I build, if I, in a perfect world for me, I'm building my logic model and my data management plan, and then my proposal grows from there. So, uh, and a lot of times, if you can, it's very good to at least have these conversations with your people, with your team, and especially the people that are actually collecting, your CHWs as well, the people that are actually involved with the collection of the data, to kind of walk it through and figure out how these things need to get addressed uh, before before anybody asks you about them. Put it like that. Hit our conclusion on this one, Brandy.
DMP conclusion. In a DMP, recipients are expected to describe how they intend to manage, preserve, and make accessible data generated or collected with CDC funds. The DMP should be developed during the project planning phase prior to initiating data generation or collection activities. If the project involves the collection or generation of public health data, CDC will require the DMP with the initial funding application or soon after the award begins. In general, all CDC funded public health data sets are expected to be made freely available to the public in a timely manner. If the data won't be made available to the public unrestricted, a strong justification is required.
There we go. So I want to do 5 minutes or so on program evaluation before I switch it over. But I want to pause for a second, just because I know we hit kind of data management plans kind of hard and kind of quick. So I'd like to pause really quickly to see if anybody has any questions, if anybody has any of their own data management things to kind of throw out, a kind of fun. Rhonda might have a fun project for us to tackle really quickly. Anything really going once, going twice? All right, I'll check back in with everybody at the end. Let's get into program evaluation, Brandy.
Program evaluation and quality assurance. Program evaluation. Program evaluation is a systematic collection of information about the activities, characteristics, and outcomes of programs to make judgments about the program, improve program effectiveness, and or inform decisions about future program development.
Yeah, keep moving. I just want to get to the difference between research and surveillance, and then I'll probably pause. Keep moving.
Types of program evaluation. There are several types of program evaluation. Several types of evaluations that are commonly used in the public health field are described below, although this list is not exhaustive. 1. Formative evaluation refers to assessments conducted to inform the development of a program. For example, conducting community needs and asset assessments and focus groups to identify appropriate cancer control strategies. 2. Process or implementation evaluation is conducted to assess whether a program has been implemented as intended and why or why not. 3. Outcome or effectiveness evaluation is conducted to assess whether a program is making progress on the short term, intermediate, or long term outcomes it is intended to yield. 4. Comprehensive evaluation is a term that is sometimes used to refer to the assessment of a program's implementation and effectiveness. That is, evaluators conduct both process and outcome evaluation activities for a given program. 5. Efficiency evaluation is conducted to assess whether program activities are being produced with efficient use of resources, including staff time and funding dollars. 6. Cost effectiveness evaluation is conducted to assess whether the benefits of a program sufficiently exceed the cost of producing them. And 7. Attribution evaluation is conducted to assess whether the outcomes being produced can be shown to be related to the program as opposed to other factors or initiatives that may be occurring at the same time.
Okay, thanks. We're going to get into this a little deeper down the road when we do our need conducting community needs assessments and things. But I wanted to kind of throw in here, because all of these things are tied into each other. I want to throw in all of the different kind of ways that we need to think about evaluating our programs. Excuse me, this isn't all of the different, a few of the different ways we need to think about evaluating our programs as we think about data management and we think about process outcomes. So the big deal here, remember, we're on our strengthening proposals for funding context here. Our big idea here is to give uh, a big picture on the big, all of the different components. Well, a lot of the different components associated with evaluation, and then keep those in mind as you are thinking about data management, program evaluation, and budget. All right, keep going, Brandy.
Differences between program evaluation and surveillance. Program
Yay.
evaluation and surveillance are companion processes. Surveillance is the continuous monitoring of or routine data collection on various factors, in parentheses, example given, behaviors, attitudes, deaths. When incorporated into program planning and formative evaluation activities, surveillance data can help focus program scope and efforts. Surveillance data can also be a good data source for addressing evaluation questions about program activities, outputs, and outcomes. However, program evaluation is broader in scope than surveillance and requires data collection and analysis methods beyond surveillance.
Good. Pause. Thank you. So remember, TDH, big on surveillance. That's mainly what they deal with there. The different project partners, you all may have university project partners. You may have different entities that are more research based, that are interested in specific research outcomes. They have different relationships with the TDH. But TDH, by and large, is interested in surveillance because that's what they do. Public health is about evaluating and surveilling for spikes and lulls and different things in different communities and addressing and responding to them. So you could imagine, or it's reasonable then to believe then that TDH's big deal is surveillance. So that's your bar to click when you see the differences. And a lot of times the RFPs themselves will say these funds are restricted. Fundies or subawardees will not, these funds cannot be used for research. Sometimes they say they cannot be used for lobbying, whatever. As always, every time we talk, every time you talk to us, we're going to say, remember, read your RFP, read the fine print, because the differences in the announcements, the difference between what actually gets funded is laid out directly in your RFPs, in the NOFOs, and absolutely in your contracts and your subaward agreements. All right, I think I want to show one of our fancy little diagrams or something, and then I'll kick it on over. What time is it? Can I get a time check? Can I stay honest?
It's 11:36.
Oh, I'm late. Okay, so then I will wrap this up. I didn't want to go too far into this, so I think that's definitely as far as I need to go. There are a few more slides, and these slides will be available to everybody too. I didn't need to get too much deeper into evaluation, but I wanted to hit some really key terms to make sure that everybody is also focused on the idea that data in itself needs to be managed on its kind of with its own purpose and program, and that the packaging and well, that's it. The packaging and process of data management is essential, and it's not hard to do, but it's something you need to think about on the front end. So I'm 6 minutes over. Apologize, and we'll be hanging around. If you have any questions, I'm really easy to find. Thank you. Your turn, Mary.
Thank you, Tariq.
Uh,
All right, let me share my screen here. Presentation mode. All right. Sorry, let me. Okay, great. So, and if I'm looking over to the side, it's because I have trouble reading sometimes. So I have everything up on my big screen. But Yeah, so we'll just jump right into budgeting for grants. This is going to be just an overview. I hope to provide some kind of practical information. This is not going to be super in depth. And I'm sure there are folks on this call who could probably teach me a thing or two about budgeting for grants. I do have a background in grants management and also a background in consulting, doing grant writing and financial management consulting for nonprofits. So I have experience in this area, but there's always something new to learn. Like Tariq said, if you have any questions, feel free to put those in the chat. I'll try to keep an eye on it. Or if you just want to unmute yourself and say, excuse me, that's great too. I do not mind. We can keep it conversational and casual. Okay. So just to kind of level set here, as far as budgeting for grants and being grant ready, the two main things that you're going to need starting out is, of course, an operating budget. Most grant applications, particularly I find foundations, will ask for both your operating budget and the budget for the proposed program. Federal awards typically are just asking for the budget for um, budget. Um, it really is best practice to have a budget for each program. So if you have multiple grants that are funding one program, you want to have a budget that takes that into account. So you don't want to just have a separate budget for every grant, but think about it in terms of programs. And so if you have revenue, other revenue that is funding that program, like fee for service, you would want to include that as well as the grants that are funding that. Of course, all the program budgets should add up to create the operational budget. Um, and in terms of why the budget is so important when we're talking about grant proposals, is because along with the proposal narrative and the work plan or the logic model, along with all those pieces, the budget is also defining your scope of project, which is extremely important. If you're talking about doing some work in your narrative, but that doesn't show up in your budget and it doesn't show up in your budget narrative, the funder is not going to be convinced that you're really going to carry that out. Because typically you might be able to shift money from line items in your budget. There's different thresholds depending on, if it's a federal award, and then even within federal awards, depending on what agency it's with. I know on CMS grants I've worked on, the threshold is 10%. So, if you're working on the grant, you have an approved budget, you realize that you need to move line items, as long as it's less than 10%, you can move that without prior approval. On some HRSA grants, I've seen the threshold be as high as 25%. When you're talking about foundations, that's something where you're going to have to go to the funder and say, hey, we're thinking about moving this around. It's going to be up to the funder. But particularly with federal awards, you can shift from line item to line item. But if you don't have something in the budget at all, it's a different matter to get it put into the budget after the fact. So that would require, a formal amendment. And that can be a complicated process, because when you're amending that budget, you're asking for your scope of project to be amended. And it all goes back to the scope of project. What are you using this funding for? It's important to read. This kind of goes without saying, but it's a really good reminder. You want to read the NOFO or the RFP or the RFA. I've noticed the state has been calling them RFAs. So for Tariq talked about the NOFO being the Notice of Funding Opportunity. RFA would be requests for applications. RFP is requests for proposals. Whatever it is, or if it's a foundation, it might just be their grant guidelines on their website. Um, whatever you're looking into, you want to read that thoroughly, to make sure that you're not including any unallowable costs in your budget, because that's going to be a big red flag, obviously, to the funder, that either you didn't read appropriately, or you didn't understand the purpose for the funding, and again, your scope of project is not matching what the funding is for. Um, as far as foundations, you also want to, like I said, review the guidelines on their website and really pay attention, because typically they'll have like something that they're specifically focusing on. Maybe they'll have like 3 initiatives that they're focusing on for this year, or these 10 years, or these 5 years. You want to pay attention to that and make your budget narrative, and your proposal narrative match that. Use as much of their language as possible so that it's really clear to them. Okay, so we've covered why it's important to make sure that your budget includes everything that you need to do under the project. And a good step to ensure that you aren't missing anything is to really sit down and go through your plan of action. So if I were to be awarded this funding, what's the first thing that I have to do? Do I have to hire new staff? Do I need to establish policies and procedures? If in order to do that, do I need to talk to a consultant? Do I need to buy equipment, supplies? Will I have subawardees? Will I have to pay invoices under this grant? Will I be providing care? So think through all of those steps, and it's really important to talk to your program staff as well, the folks that are on the front lines, on the ground, doing the work, because they will definitely let you know if you miss something. And then the key to the plan of action is to tie an expense to each step. So even if it's something that, maybe you're already paying for with something else, but you're going to be leveraging that resource in this grant, try to tie an expense to that if you need to include it here. After you have your plan of action, all of your expenses listed, that's when you're going to start organizing them by line item. Of course, line items vary by funder, because why not? So when you're looking at federal awards versus state versus private foundations, they have different definitions for what belongs under each line item, but these are just general line items that I'm listing out here, and we can actually go look at some examples. I think would be good. Now I think I'm sharing my screen and not just my PowerPoint. Is that right? Can everybody see now I have a HRSA budget template pulled up?
Yes.
Great, thank you. Okay, so this is actually, I mean, and I know no one here receives HRSA health center funding, and specifically because we're not FQHCs, but this is just a general example of a HRSA or a federal um, budget template. So you can see the line items here, and there's going to be definitions as well. Looking at state, and the state budget templates are available. This is a TDH one. That's probably what most of us use if you're applying for state funding. But so they have line items: salaries, benefits, professional fees. So these are the line items here that they use. This is the budget overview, and then this is your budget detail. I think I have an example of some foundations require that you use their template. That's actually, I find, really common. But if you already have your budget, it's really easy to just put it in their template. When we're talking about personnel costs, That's going to be comprised of salaries, and also the next slide, we're going to talk about benefits and taxes. I'm going to go back here. But when we're talking about allocating salaries on the budget, you want to think about the percentage of staff time that will need to be spent on this program. Um, some grants will specify that for certain positions, there has to be a certain level of effort. So I've seen that with federal grants where they might say that the designated project director of this grant has to be dedicated at least 50% of the time to the project. Sometimes it's 100%. Saw on another HRSA grant recently that the grant was requiring that you hire a data management position that would be 100% dedicated to that program. So you want to be mindful of that, of course, if there are requirements. If there's not, then it's up to your discretion and what is going to be needed to complete the project. But just a reminder that you should have a way to track all of your staff allocations. And you need to ensure, of course, that you're never going above 100%. So, if you have a position that's currently 100% funded by one grant and you're applying for a new grant, and it seems like, okay, this is a good fit, and this person's already, taking care of this project, this is a similar project, so they can just oversee both. And you're maybe going to, change their allocation to 50% on one and 50% on the other. You need to change that. So if you get more funding for the same position, you need to drop their allocation on the previous grant. So that gets into the territory of what Tariq mentioned with double dipping. Double dipping would be one example of double dipping would be if you had a position that was funded. Oh, all of their allocations would add up to over 100%. You don't want that. So you need to have a way to track that and keep up with it across all programs. This is the example of for RCHW grant. We sent a template to help subawardees determine, so you would want something like this, and I can send this out to others too that can use it just as a basic template. But you would put in the total annual salary for the position, you have their name, the position title. Then when you adjust for the percentage, it's going to adjust the allocation. So, if we took it down to 30%, it would adjust the allocation and automatically adjusting your FICA, Medicare, SUI. If we had health insurance and retirement in here, it would as well too. So, you want to have something like this to help you with your allocations. Speaking of benefits and taxes, these are the current amounts for 2022. So Social Security or FICA, you're looking at 6.2%, Medicare is 1.5%, and SUI, if you pay that, is 5%. If you offer health insurance, retirement, life insurance, accident insurance, all those other benefits, you want to calculate the average expense for a full-time employee. And then again, you'll be using that allocation percentage to determine how much you would be charging to this grant. So, if the person is going to be 100% on this grant, it would obviously be the full cost. If it was 30%, you would multiply it by that allocation to get the total cost. Just as a general practice, it's really helpful if you have the global cost, so the cost of salary plus benefits and taxes, defined and regularly updated for the positions that you hire for, so that as you're having conversations, because sometimes conversations with funders can happen on the fly, right? So I think it's helpful to kind of have in your mind, okay, if I want to hire a CHW, for example, I need to have $50,000. That'll cover salary, benefits, blah, 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 or whatever the number is. I'm sure you all know about providers and, how much it's going to cost you to hire a provider. I know that's a big need. I did see a question in the chat. Hey, Jenny. So I think we're talking about indirect costs, and I'm going to talk about that next. So we will go into that. Um, Yes. So, direct versus indirect. So you've got this list of costs, you're organizing your line items, and you need to determine which costs are going to be directly billed and what is going to be covered under indirect. Direct costs, and these quotes are straight from the OMB Uniform Grants Guidance. So these are federal, but even if it's not a federal award, if it's a state, it probably is federal funding. This is kind of like the most rigorous, so you just want to go by this and it should work for everything else. So that's where these quotes are coming from, but they define direct cost as a cost that can be identified specifically with a particular final cost objective. The final cost objective is kind of a fancy way of saying the source of funding, so the grant, or that can be directly assigned to such activities relatively easily with a high degree of accuracy. So something that is clearly directly involved with this grant. So if it was a CHW grant, the salary of the CHW, obviously, that is a direct cost. Now, within direct costs, and this is where it can get a little hairy. Within direct costs, there are kind of two subcategories. So there's direct costs that are associated only with a single cost objective. So that would be a direct cost that is just for this grant. It doesn't benefit any other grant, doesn't benefit any other program. And then there's joint costs that can be apportioned and charged directly to benefiting cost objectives based on established allocations. So this is where we talk about allocations. So for example, you have uh, um, so if you're talking about like the rent for your space, um, if you have a space that is providing office space for two different programs, um, and it's very clear that, okay, like there's two offices and one office, one desk within the office has somebody funded by this grant and the other desk has somebody funded by this other grant. You can divide it 50-50. It's a joint cost, but it's easily apportioned between two sources of funding, right? Um, and then you have indirect costs where it's like it's more difficult. So the actual definition is it's incurred for a common or joint purpose, benefiting more than one cost objective. So just like the joint cost, that is just like the direct cost that's jointly charged. So it's the same in that regard, but it's not readily assignable to the cost objectives specifically benefited without effort disproportionate to the results achieved. So don't you just love that language? But essentially, it's either too hard to divide it evenly among your multiple funding sources, or if you were to try to divide it, it would take you days and days and days, and basically it wouldn't be worth it, is what they're saying. So bearing that in mind, you do have some flexibility. This is also from the uniform guidance. So there's no universal rule for classifying costs as either direct or indirect. And when they have F&A here, they're talking about facilities and administration. So that's another term that you'll see for indirect costs. A cost may be direct with respect to some specific service or function, but indirect with respect to the federal award or other final cost objective. Therefore, it's essential that each item of cost incurred for the same purpose be treated consistently in like circumstances, either as a direct or an indirect F&A cost, in order to avoid possible double charging of federal awards. So long story short, you have flexibility, but it needs to be consistent. How is it consistent? You have a financial management policy in place for your organization that clearly defines what you consider to be indirect costs, facilities and administration to different grants. So yeah. Getting more into Jenny's question, you can either, so with federal awards, and then usually the state will honor if you have this for federal awards, you can get a negotiated indirect cost rate. And that is a process that I'm not going to fully go into today, but we can talk more about it offline. If other people are interested, we can talk through it. Annabelle, I know, has gone through that process before, so she would be a really good resource on that. But there's a formal process to go through to get a negotiated indirect cost rate. If you don't have a negotiated indirect cost rate, you can use what's known as the de minimis, which is just 10% of the modified total direct costs, and that can be used indefinitely. So in order to use the de minimis, you don't have to like submit a plan to be approved. You don't have to list exactly what's going to be considered an indirect cost. You know, internally you should have that, but you don't have to basically get approval from an outside source. If you choose to use the de minimis, you need to use that consistently for all federal awards until such a time as you do a negotiated rate. So that is the deal with that. And it recently changed in 20. Going to look at 2020. It changed to where, so it used to be that if you used the de minimis and then you went to a negotiated rate, you couldn't go back to the de minimis. And some little caveat changed with that. So I think there might be a little bit more flexibility now, but I'll have to look that up and follow up with everyone because I don't want to say something that's incorrect. Yeah, so that's it on indirect costs, unless anybody has any specific questions on that. Okay, and we just have a couple more slides, so we're going to try to end early today. Back to the program budget. So we kind of went through all the expenses, and now we're going to talk about revenue. You want to include all sources of revenue on your program budget. If it's an existing program, what are the sources of revenue that you're currently receiving? I've even seen where if it's like a new program that you're trying to start, if you've asked for money from different people, you can actually put it in, but put like that it's pending. And that just helps to illustrate, again, like your sustainability, that you're actively fundraising for this. Some grants also require a match. So usually they're called matching grants. Um, go figure. I know the one that comes to mind first and foremost is AmeriCorps because we applied for that one recently. But there are other grants that also require a match. If a match is required, those details will be in the NOFO or the RFA or RFP about what the percentage of the match is. And then they're going to want to know what is the source of revenue that you plan on using for that match to make sure that if they award you, you have, excuse me, the matching funds. If you receive in-kind donations, and that could be physical donations or donations of time, and I'm sure this applies to a lot of our members who receive volunteer time from medical providers, you can include that on your budget as an in-kind revenue. You just also want to include it in an equal amount as an in-kind expense. So essentially it zeroes out, but it's just a way to kind of show the big picture. Again, it also illustrates that you have community support because you're receiving this valuable contribution of volunteer time. So that's just a note on that. The budget narrative and or justification. For federal awards, they tend to call it budget justification. It just reinforces the grant request. Again, you want to go through your entire budget. Just a general rule to get started would be if they don't have a specific template. So I'll go ahead and pull these up, I guess. But with federal awards, they will have a specific template that they want you to use for the budget narrative. So here you can see, and it has, they just basically want you to break down, how did you get the FICA amount, retirement, how did you get your travel expenses? So if you're sending people to a conference, what is the training on? How much is it per person? How many FTEs are going? What's the hotel per night? If it's for outreach, you need to have your mileage rate in there and how many miles you anticipate the staff going. Show you the AmeriCorps example as well. So in this one, they have you list the personnel salaries at the top with the percentage of time, and then it's just breaking everything down so that there's no questions of how did you get to this amount. Really important, because the fewer questions the funder has, the better for you. If they have too many questions, they're probably not even going to bother asking for clarification. It's just going to be that you're denied. So there's some detail. If it's a foundation or another funder that doesn't give you a template, this is a really good example of kind of how to get started. This is really old, so obviously, the salaries are outdated. But this is a good tool of where to get started. So you basically are just going to take every line item, define it. You got your total here, which should match what's on your budget, of course, and then you're breaking it down by position. You're giving just one or two sentences on each line item or each sub item, just describing this is their salary, this is how long they're going to be working on the contract, this is the amount of time, da 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 da. Fringes, again, you've got the total salaries times the percentage to get the taxes amount, unemployment, retirement, da 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 da. So again, it's just one or two sentences on each line item explaining it. If there's any questions or any other information that you can think of, try to read it. Because you can even have, like, in addition to all of this, I think it can be a good idea to even include at the beginning or the end a couple paragraphs. That's just kind of a general overall, this is how we're going to use the funding. This is how we're going to ensure that we're using the funding for what we said we will. So if it's a federal award and you've had federal funding before, you want to mention that you were a good steward of it, you're familiar with this funding. Same thing if it's a state or it's a private or a foundation or a private funder. You want to talk about what a good steward you've been of funds in the past, and highlight anything there. You want to read through it as the funder and try to think of what questions they might still be outstanding that aren't answered by this, and you would want to put that in the narrative as well. I think no, I have one more slide, which is just resources. So when you're looking at federal grants, there's two CFR 200. This is the general uniform administrative requirements, cost principles, and audit requirements for federal awards. So this is for any federal agency. It's over all of them. Then there is, for HHS awards, there's 45 CFR Part 75. So that's going to be any agency of HHS. So HRSA, CMS, any of those, you would want to use this. There's also the HHS grants policy statement. It hasn't been updated, in a while, but it's kind of more in everyday language. So it can be helpful, especially if you read something in here and it's a little confusing. Try to find it in the grants policy statement. Again, if it's an HHS award, to see if it matches up or if it helps you with some clarity. So those are good resources if you have questions about whether something is allowable, how to allocate it, things like that. And then the state has policy 3. So if you're doing if you're preparing a budget for a state proposal, this document gives some details. It helps define what they consider, direct costs versus administrative, um, versus allocable direct costs. Talks a little bit about allocation methods, and then it kind of defines line items as well. So that could be helpful. And that concludes my presentation. The recording will be available. I can make the slides available with all of the links in them. Yeah, so does anyone have any questions before we adjourn and give you 21 minutes of your day back? Going once, going twice. All right, well, thank you.
Let me jump in really quick, Mary. We're going to. I just wanted to say to the IDC question: always, if you can, word to the wise, use the de minimis whenever possible. But you still have to be careful with that. A lot of times, the RFPs have caps on IDCs, especially with the service agencies. So read your RFAs very carefully. Make sure that you are adhering, of course, to the IDCs. Use the de minimis whenever possible, because you don't have to justify, but be very careful in that context. So thank you all.
Thank you, Tariq. Yeah, that's a good point. Actually, when we were looking at a HRSA grant the other day, that specified 8% would be the highest indirect cost rate you could use. So
that's right.
All right, y'all have a great day. Thank you so much. I really appreciate everyone taking the time out of their day to join us. And thank you to Tariq again. Yeah, everybody have a good day.
Thank y'all. See you next month.
Bye.